the best Rotary Club in the known universe, and the last meeting of this Rotary year. It's my pleasure to moderate today's session. I'm still in the seat, so I have one more role, and it's my pleasure to introduce Dr. Schlaudecker here today with discussion from about infectious diseases from UC, and she will answer plenty of questions, and she will stay later if you have questions afterwards. It's my pleasure to turn it over to Kate Atkins on the keyboard and Jen Metzlar to sing The America the Beautiful. Kate Atkins.
Sorry, 75 was a parking lot. Thank you, President Garrett. Please join me for our invocation. We appreciate all the blessings and good things that happen to each of us, and we'll share our kindness, joy, and hopes for the future with those we meet today. As we begin celebrating our country's birth next week, let us recognize the forefathers and foremothers for whom we owe so much. Help us support and participate in Rotary International's work around the world that pursues education, good health, and peace. As Rotarians, we will seek and accept help to reduce misunderstandings at home and in the wider community. We are indebted to basic scientists, physicians, and their lab partners whose focus is on preventive health for our children and for us. The field of infectious disease has solved many health mysteries, and yet more seem to erupt. Please watch over all our health and wellness professionals. They are critical to our well-being. Guide us in the spirit of peace and goodwill toward all. Inspire us to remember and nourish our own spiritual selves. We thank all those who grew, harvested, prepared, and served our meal today. Amen. Now, let us repeat our four-way test of the things we think, say, and do. Is it true? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Thank you.
Okay. My pleasure to entertain along with our guests and those who are sharing the update. President Eric, yes, today, everyone, we have the fabulous 5 of guests. Beginning with Elizabeth Bangles Sailing with the Seasons, brought to you by who else but Michael Stossman. Stand and wave to the audience, that will be great. Rachel Flink is with the University of Cincinnati. He's a professor of special education, brought to you by Bob Ranger. coming to the member review committee today, which if approved will be free for Lisa in the new year. And you've probably seen the posting for the new basic director of business development within the club has been announced. It's out live. So if you know people that want to apply, please pass that along. My pleasure to bring up Mr. Michael Schatzman, membership czar of this club, to introduce Joseph Davidson.
Thank you, President Eric. Congratulations, you're almost there, buddy. Well, good afternoon.
Good afternoon, Michael.
It's my pleasure to introduce one of the newest members of the Rotary Club of Cincinnati, Joseph Davidson. Joseph brings a rich blend of creativity and strategy to our club. He holds a bachelor's degree in creative writing from Southern New Hampshire University and an MBA from Western Governors University. Professionally, he served as a communications and engagement officer at True Partner Credit Union, where he worked to connect individuals throughout the community with essential financial resources. What drew him to Rotary was his genuine love for helping others. He quickly recognized the power of Rotary to make a meaningful change, and he knew he had found the right place. That passion has already translated into action. Joseph is actively involved with both our social media and picnic committees. Now, I'm going to give you a peek ahead into the future where it's about to come. We're having a picnic this fall. Josh, are we having a picnic? Josh, don't worry. Yeah, we have a picnic this year, Josh? Okay. So, there's a brand new, brand spanking new, I don't know if it's been released yet, flyer about said picnic. It was designed by none other than Joseph Davidson. So thank you, Joseph, for donating the time. When he's not working or serving, Joseph enjoys spending time outdoors with his 4 dogs, exploring national parks, and hitting the hiking trails. He's also an avid reader and writer, and a natural storyteller at heart. Please join me in welcoming Joseph Davidson to the Rotary Club of Cincinnati.
So Michael teased the picnic. Let's hear more about the picnic from Josh Vogel, who's a board member on our Rotary board.
Thank you, President Eric. I want to make sure I get the date right. In your calendar, Saturday, August 23rd at Camp Allen. The picnic is back. So anyone that has a classic car, we will have a classic car show. You can bring your classic car to show off. We will also have a host of other activities, including cornhole tournament, bingo. So who likes bingo? I like bingo. Fishing derby. We'll have prizes for bingo and the fishing derby and the cornhole tournament. We'll also have tours of Camp Allen, hosted by Michael. He doesn't have to get a driver's test before he drives our golf cart, though. And then we'll also have family pictures as well. So please go ahead and register. If you register before August 10th, adult tickets are $30 and kids under 12 are $5. That price will increase to $40 after the 10th for adults and $10 for children. Please bring your grandchildren, your children, and yourselves to the picnic. Let's make it an awesome day out at Camp Allen.
All right, so the quiz is, when is the picnic?
August 23rd.
What time? 4 to 7. 4 to 7. Put it in your calendar. Otherwise, Josh will hunt you down and make sure you go, right? Should be a great event, great way to introduce prospective members as well, and to learn more about Camp Allen for the newer members. So today we have only one committee meeting. After this meeting, Membership Review Committee will be bringing in 3 new members. We have 3 birthdays: Brooks, Barbara Dickinson, and Taylor Young this week. And we also want to celebrate a special birthday to John Frank, who is here. Happy 93rd birthday to retired John Frank. And Valentine's Day in 1957. John Frank became a member of the Rotary Club of Cincinnati 68 years ago. Again, another round of applause for our longest. If you haven't seen it already, you can see John painting the walls in Avondale with his granddaughter, which is a pleasure to see, and you're still getting out there and being active, so thank you for all you do. Probably the most important part of today is split the pot. We have $41 for the winner and $458 for the big pot. I want to ask our guest speakers to pick the ticket. It was a combination of orange and white. So yeah, you just either color, whatever. All right. It is an orange ticket.
I win!
We already have winners. All right, the winning number is 344-117. 344-117. Okay. Thank you.
So she is going to membership review today. She's not technically a member yet, but
Go ahead.
we're looking forward to being a part of this.
So close. All right, thanks for joining back. So we have some upcoming events. Get rid of coffee Tuesday, July 15th from 8 a.m. to 10 a.m. at the HG Coffee House in Blue Ash. Feel free to bring a guest or prospective member. We also have Rotary Euchre on Tuesday, July 22nd at Jan and Owen Rasmus' house. You may see some of his pictures. You can bring your own picture of Owen if you want. All levels of playing ability are welcome. Bring your spouse or guest. Arrive at 6:30, play begins at 7. Please RSVP no later than July 17th at Owen Rasmus. We have a Rotary Connect event on July 28th from 6 p.m. to 10 p.m. The committee is hosting a family-friendly network event at Great America Ballpark to see the Cincinnati Reds face the LA Dodgers. The game time is 7:10 p.m. The event will take place in the Champions Club. Ticket cost is $111.96 and includes food, non-alcoholic beverages, and game admission. There are only 50 tickets. Use the link in DAC TV to purchase your tickets. Or Taylor Young and Ben Busby with questions. It's my pleasure to introduce Nancy Reese to introduce today's program.
Well, I am very excited and delighted and honored to introduce you to Elizabeth Schlaudecker, Dr. Elizabeth Schlaudecker. I've been calling her Dr. Liz for so long, you forget. So anyway, Dr. Liz is an Associate Professor of Pediatrics at the University of Cincinnati College of Medicine. She is the Medical Director for the Division of Infectious Diseases and the Associate Director of the Pediatric Residency Global Health Pathway at Cincinnati Children's Hospital Medical Center. That's a lot. Anyway, Dr. Liz graduated from the University of Cincinnati College of Medicine. Her residency, her chief residency in pediatrics, and her fellowship in infectious diseases were all done at Cincinnati Children's. She also has a master's degree in public health. She likes to study. Anyway, Dr. Liz enjoys learning how infections have shaped our world and society, and how interventions like antibiotics and vaccines can prevent infections. She also enjoys figuring out what is causing infections and how to best treat it, which I love too, having worked in microbiology. Her primary research interests focus on the safety and effectiveness of vaccines. In particular, her research aims to prevent respiratory viruses in infants and children by vaccinating pregnant women to prevent their infants from contracting infectious diseases early in life. A fun Rotary-related fact about Dr. Liz and her husband Jeff, that during one of their global experiences, Dr. Liz and Jeff administered the polio vaccine to people, actually infants in Kenya when they were there studying in fourth-year medical students. During the COVID-19 pandemic, Dr. Liz served as an investigator for CDC's project to monitor vaccine safety in pregnant and in individuals. Over the past few years, she has worked on one of the investigations in Pfizer's maternal RSV trial. And this is really important because it's one of the most feared diseases in infants in pediatrics. So, if I would list the many awards that Dr. Liz has, we wouldn't have any time to listen to her. So I'm only going to mention a couple of them that I picked out. For her role in investigating the safety of COVID-19 vaccine, she received CDC's Science Award in 2023 for the most outstanding peer-reviewed research paper. Say that 3 times fast. I think this is really exciting. Both 2017 and 19, Dr. Liz received the Most Excellent Teacher Award at the University of Cincinnati College of Medicine. I'm sure those are some tough students. Dr. Liz also received the Pediatric Infectious Disease Society's Blue Ribbon Research Award for maternal vaccine research in Bangladesh. Doctors Liz and Jeff have 3 children. It's Noah, Jane, who is with us, and Ben. And they just completed the 12th, 10th, and 7th grades respectively at Walnut Hills High School. I was going to say, we have a few Walnut Hills fans here. Dr. Liz spends most of her free time running, reading, riding her bicycle, and traveling. She also spends a lot of time spectating at cross-country meets, Irish dance competitions, and soccer games. If Dr. Liz's name sounds familiar to you, that's because she enthusiastically agreed to lead our book discussion we had back in January on a book about polio with Dr. Saban as part of it. And she agreed to lead our book discussion at our event for Women in Rotary. So let's listen and listen to some amazing women. Thank you, Dr. Liz.
That was a very generous and kind introduction, and I am really excited to be here. I love to talk about infectious diseases, and I love to talk about vaccines, and thank you guys for also allowing me to invite some of my family members too. And I don't think most of you have not had to listen to me before, so I asked Jane not to throw tomatoes at me while I was presenting. So you guys heard a little bit about me, but I also put them up here to remind everyone that vaccines are kind of what I do and what I'm passionate about. So that, in full disclosure, that is going to be what we're going to talk about today. So we're going to start out with painting the picture of the historical context of infectious diseases. And as you heard, that's a big reason that I went into pediatric infectious diseases, because I read a lot of books like The Secret Garden when I was little, and I realized that infectious diseases have had a big impact, even in the last 125 years. So it's 1900, 24% of all children die before their 5th birthday. And the 3 leading causes of death in children are pneumonia, tuberculosis, and diarrhea. So where are we? What country do you think that is? Yes, so of course, it's a trick here. It is the United States. And 1900, not that long ago. Honestly, a lot of things that we have done in the last few years have been within 125 years. So here's a little graph that I took from the publication below that shows from 1900 to 2000 the death rate in the United States and all the things that we did to change that. So first we started having health departments. So we realized that it would matter if we took care of people and took care of their health. Then we started putting chlorine in water and making sure we had clean water. The flu pandemic there had a big blip and really kind of messed up our trajectory. Then after that, the plague, we developed the first use of penicillin. And you can see here the Salk vaccine was introduced, but more importantly, the Sabin polio vaccine was introduced in 1961. And it's a big part of working at Cincinnati Children's, and especially in the Infectious Disease Division, to be very proud of our role in creating new vaccines, including Dr. Sabin's polio vaccine, and then Dr. David Bernstein and Dr. Dick Ward, the rotavirus vaccine, and Dr. Bernstein, still working hard. He keeps saying he's retiring. And Dr. Ward, we see frequently at Knox Church. They both keep track of everything that's going on. And then the passage of the Vaccination Assistance Act. So all these things really changed. This is very tiny, but what I basically want to show you guys, in 1900, infectious diseases were the leading cause of death, but by 1997, infectious diseases were way down here. Pneumonia and influenza and HIV and infection, way down the list. So we're like, we don't think we need infectious disease doctors anymore. We've got this covered now, it'll be fine. And there was a period there where they thought infectious disease as a subspecialty would die because we have antibiotics and vaccines, and so we've got this. This is no problem, right? And this is another picture that I think is important to Rotary International, as well as anyone in the United States, and having context for the rest of the world. So that picture that I painted in 1900, the rest of the world in low-income countries, still neonatal conditions, which are also often infectious, lower respiratory infections, are still the leading causes of death around the world. So we think we're making progress, but what is the other little surprise we had that I like to block out about 5 years ago? So here is the CDC's 10 leading causes of death over just a couple years, 2019 and 2020. And you can see here, heart disease, cancer, leading causes of death in the United States. And then what popped up there as the third leading cause of death in 2020? And of course, all of you guys know COVID-19. And then there was a moment where we as infectious disease doctors and physicians and humans realized, well, we actually might not have this infectious disease thing completely covered. Like we actually might, we might not always be ahead of the game. So that is where this picture you saw, this is a little bit of what I want to talk about briefly today. That is where we continue to exert our efforts. So this is me back when I was a medical student, and my husband Jeff and I spent 3 months in Kenya doing a rotation there, and we got to spend a day with the community health workers going out into the community, and they had a very, very regimented schedule where they would go to each community once a month so that they could keep up with the vaccinations in those regions. And the moms would come with their little vaccination cards and line up outside, and we would weigh the babies and give them their vaccines. So this, of course, is the polio, the Sabin polio vaccine being given to a baby in Kenya, which was a great honor and really something that changed the trajectory of my career choice. Because as a medical student, I wasn't quite sure, and I decided at that point I wanted to go into infectious diseases. So over the past 100 years, vaccines have extended our lifespan by 30 years, which is a little bit hard to wrap your head around if you lived in the age of having vaccines and not getting those diseases. And many of you probably remember a time when you had diseases that were not covered by vaccines. Polio is a big example of that. A lot of people remember the fear and the terror of hiding in your houses and your parents not letting you go out in the summer because you were afraid of polio. So I'm just going to briefly show this map of, just to give a picture of the 20th century annual morbidity compared to our 2024 reported cases. These are all the vaccines that we have had for a while now. So you can see here, smallpox, 0. Diphtheria, 1 case. Measles, 266 cases. We'll get back to that shortly. Mumps, pertussis, polio, 0 cases. Rubella, 9 cases. Congenital rubella, 0 cases. And tetanus, 32. So this is quite remarkable. These diseases, within 100 years, completely changed a childhood in the United States. Here are some other newer vaccines, and I'll show you a little bit about those, but hepatitis A, hepatitis B, pneumococcus, and then the rotavirus vaccine, one of which was invented at Cincinnati Children's, really changing both globally and the US, the morbidity associated with rotavirus. So, anybody heard of HIB vaccine or Haemophilus influenza type B? That's because we don't see it anymore. It's fabulous. So back in the 70s and 80s, many children would come into Cincinnati Children's and they would have meningitis due to this illness. And it was a very common cause of meningitis, and there was nothing we could do about it. 70% of bacterial meningitis cases. And this is even, a lot of my colleagues were around during this time period, because this was mostly in the 80s when we were seeing meningitis cases. And so within a few years of vaccinating against HIB, we decreased the number of cases by greater than 99%, really almost eradicated it. And it's a part of vaccines around the world here. Here's Dr. Jeff giving the pentavalent HIB vaccine in Kenya. And the good news about this vaccine is it continues to have an impact around the world. Unfortunately, there are places that don't have access to vaccines. Kenya, fortunately, has a pretty good vaccine rate, but many places do not. And so we still see probably about 200,000 deaths around the world globally due to this Haemophilus influenza. But look at this cool graph here in the United States. So between 1989 and 1995, all of the infants are receiving HIB as part of their newborn and infant vaccinations, and almost vanished, which is great news. But guess what I started to see in the last few years? When families have decided not to vaccinate their kids, I've started to see HIB meningitis again. And I, in fact, have seen a couple cases in the last few months, and thankfully the parents, after the episodes, have decided to vaccinate, but often a lot of the things are irreversible once you have meningitis. So another great success story is strep pneumoniae, and that is that pneumococcal vaccine, which you also get when you're little, Prevnar, and that one, we used to have a vaccine that didn't work well in children, so in the 90s they developed a conjugated vaccine, which basically meant you attach a protein to the vaccine so that you get a long-term response. So little kids were then able to get protected for a long time, and then we saw a really great 59% decline in pneumococcal disease and pneumococcal meningitis, which is another one that we saw a really victorious decline. And that was one that I was just finishing up my medical school and then starting pediatric residency, and it was changing the face of meningitis as well. Now, actually, when you're a pediatric resident at Cincinnati Children's, you don't even do that many lumbar punctures because we don't see meningitis that often. So that's really great news. So these are all really awesome success stories, but part of why I'm here today is because of all the work that Rotary International is doing. Because you'll see one in particular up here, measles, that is not 0 as it used to be. So that is a little bit of what we are struggling with right now. I'm going to show you guys a couple of slides about measles, because some of you maybe have seen it before, depending on your age, but most people have not. Measles is not something that parents are afraid of anymore because parents have never seen it before. So it starts with a rash and you have a runny nose, and we are the only natural host. So that makes it a really great one to eradicate. It's not hiding out in animals and other hosts, and it's very contagious. And you've heard about that, of how you can just be standing around someone who had measles and you can still catch measles. So the bad part of measles is that some people get better and some people get much sicker and get things like acute encephalitis. And 1 to 3 of every 1,000 cases results in death. So this is a very terrifying thing for both pediatricians and for infectious disease doctors, because we have a great, amazing, safe vaccine that works really well that was licensed in 1963, soon after the Sabin polio vaccine. It resulted in a greater than 99% decrease in measles. And guess what? In 2000, we declared our country measles-free because it was one of the best ones, like polio, that you could actually eradicate because you can get rid of all measles in all humans if you're all vaccinated. So we reached that in 2000. That was right around the time that I was in medical school, and we were not really worried about measles, except we did see a measles outbreak when we were in Kenya, and it was very, very scary. And we were very grateful that we didn't have to worry about it because one dose of the vaccine is 95% effective, 2 doses is 97% effective. We give it to kids when they're a year old and then again before kindergarten, and then you get protected for the rest of your life. So this you may have heard about. If you can't read the cartoon from here, it says, "Yes, kids, more scary than the haunted house, measles outbreak at Disneyland." So this happened in 2015, and that was 10 years ago, but this was this moment where we realized we are one moment away from a very big measles outbreak because we had one unknown case that came to Disneyland, likely from international travel, where it is still not measles-free, and came to Disneyland, and then you would not believe how quickly it spread. You can see here, obviously the most cases were in California, but all over the country could be traced back to the Disneyland cases. And so we had cases in Ohio, there were cases all the way to New York, multi-state outbreak, and we never specifically identified the source because, of course, you often are better quickly before you realize that you have spread it. So July 9, 2019, we also started to see more cases. And here's the graph from the CDC that shows the cases up through 2024. And you can see here that we're at over 1,200 cases in 2019, and we were getting pretty freaked out. But then the COVID pandemic hit, and that sort of shut off all contact with other people. And so we saw that end that particular outbreak. But then, you guys have heard what's been happening over the last few months. So as we are seeing decreased rates of measles vaccination around the country, we are seeing more and more pockets of outbreaks. So you can see here, the last graph I showed you was 1,200 cases, and this is by week. And so we're seeing up to over 100 cases per week. This is up through today. So not as bad as it was in March and April, but definitely not away. And then here's that graph again where I've added in 2025, which is about to surpass 2019 at only halfway through 2025. And so what is the problem? Why are we seeing this? This was the measles case graph through 2023. You know, we started vaccinating and then we declared elimination, and now it's coming back again. So what has happened? Why are we seeing more cases of measles? When more than 95% people in our community are vaccinated, you benefit from the herd immunity, which is how we protect the babies less than 12 months of age who can't get the vaccine yet. It's because everybody around them is vaccinated, and so we can protect them. However, we have seen, especially over the last few years, that the vaccination of our kindergartners has dramatically decreased. So in 2019, it was right at 95% nationally, 95.2%, but then by 2023, we were down to 92.7%, which still sounds okay, right? I mean, it's not terrible, but it leaves 280,000 kindergartners at risk from the measles. Here is the MMR vaccine coverage, that's the measles, mumps, rubella vaccine throughout the country, and this is, you can't see at the bottom, but this is current as about a week ago. And look what color Ohio is. Not happy about that. So if you look at the graph at the top, we are the dark orange, which means we have less than 90% coverage in the state of Ohio in our vaccination in our kindergartners. So you do not want to be orange in this graph here. That is not a good Bengals FCC color in this situation. It is very scary to us as pediatric infectious disease doctors, pediatricians, public health people. And this is multifactorial, but we definitely saw our big first slump in vaccination when the pandemic hit. And many people, for various reasons, decided, first I think they were scared to go to the doctor, and then there lots of mistrust, lots of concern about the medical system, vaccines, the government, and so we've really seen a dramatic decline in vaccination since that time. In 2022, when I was on call, one of my jobs and one of my hats is to be on call for the CDC for vaccine safety. I'm very committed to making sure all the vaccines that we receive are safe, but we received the call that not only was New York fighting measles, but they had started to identify polio in the wastewater, and there was a positive case in an individual in this particular county. And you guys know this story. This is something we're very proud of at Cincinnati Children's. Before polio vaccines were available, 15,000 cases of paralysis each year. And of course, this is the part of infectious diseases that is why I get up in the morning and do what I do, because I think about at that time when your kid got a cold and you knew there was polio virus circulating, they might not be able to walk in a couple days. And that was it. You know, there were no cures at the time, and I cannot imagine that fear of knowing that there was nothing you could do, and hoping they weren't one of the cases that developed paralysis. So when we heard in February 2022 that Malawi announced its first case of polio in 30 years in a 3-year-old girl, and the virus appeared to come from Pakistan, which you guys probably know from Rotary International, is one of the countries that still has wild-type cases of polio. And then, of course, as mentioned, July 2022, we identified our first case of polio in an unvaccinated individual in Rockland County. So, April 24th, 1960, Saving Sunday, was when 20,000 local preschool children lined up at the offices of 300 doctors around the country. The top picture in the top right-hand corner is our research auditorium at Cincinnati Children's. We walk by it every day when we walk over to the clinic and the hospital, and I also always stop with my medical students and my residents and show them the Sabin statue that you guys generously donated. So thank you for that, because I think this is what I try to remember. Remember back when we were excited and thrilled that we got to get a vaccine because we wanted to stop a disease. So how will we respond to this? You guys are already doing a lot. I know that Rotary International is a huge part of collaborating with the World Health Organization and the CDC in allowing the polio vaccine to be distributed to help fight wild-type polio virus in parts of the world that have hard to reach. And so these are some of the pictures taken from the website. And these are 2 of the oral polio vaccine, and then Jeff giving a vaccine, and then another cute picture. And I just wanted to highlight that I know it is a frustrating and very challenging endeavor to fight polio around the world. I remember back when I was getting my master's in public health and I was a medical student, I chose that as my topic to debate of whether or not we could eradicate polio. And so we've been talking, and I'm getting old now, and that was over 20 years ago. And so I know that it is a struggle, and I appreciate that you guys are not giving up on it. So it's because I think it's possible. And as you probably know, when people don't get vaccinated, they are then susceptible to the polio virus that comes from the vaccine. So if you can't get full coverage of vaccination, then the vaccine type starts to spread to unvaccinated people, which is why the vaccination is so important. So on that note, I just want to end it with I highlighted your name there, your collaboration with really great organizations around the country. Reading is a big part of why I'm a infectious doctor in the first place. So I have a few book recommendations, and you see The Woman with the Cure is on there. Thank you guys for inviting me to talk about that, but it's a great book about the scientists involved with that. And I just read Everything is Tuberculosis by John Green. It just came out, and it is an excellent book also. And this is my family. You can tell by how Jane looks right now that this was a while ago, but it's a catchy Hamilton phrase. I'm not throwing away my shot or my oral vaccine either. Thanks for having me. Yes.
How effective have the outbreaks been in getting people to take the vaccine?
I do think, so the Disneyland outbreak in 2015, at the time, California was one of the states that had one of the most permissive vaccine policies. Like you could be exempted from vaccine for philosophical, medical, and I'm forgetting the third reason. Yeah, thank you. And they got rid of because of grassroots, it was actually a bunch of parents that got together and had a big campaign to get rid of the philosophical exemption. So that's the tricky one, of course, where you can just say, I don't like vaccines, and then you can go to kindergarten without one then, yeah. And we have all 3 vaccine exemptions in Ohio, so you don't have to provide any documentation to go to kindergarten without your vaccines. You just say, I don't like them, and I don't want to get them, which is upsetting to me. So it has been effective in some ways, yeah. Yes?
Thank you for being here today. My personal belief is that I like living, and
It's a good one.
if I had to get a COVID shot once a month, I'd do it. But I know that there are people who don't believe in that.
Yeah.
So help me understand what the medical profession needs to do to build trust in the community so that we can reach those levels that we have been at previously.
Right, and that is another like 3-hour talk that we do. We actually are spending more time now because, so Cincinnati Children's and our Pediatric Infectious Disease Division, we are really good at making new vaccines. We're really good at making sure they're safe and studying them. We're really good at explaining how they work. But then it doesn't do any good if nobody wants to get that vaccine. And so we have not really spent a lot of our energy and research on understanding why people don't trust them. Like what part of it is it that makes them nervous? Like people take Tylenol like crazy, and it's one of the more dangerous drugs like you take. But a vaccine for whatever reason, and that's also fascinating. You know, the new RSV antibody for babies, nirsevimab, it is a monoclonal antibody, and for whatever reason, people are not scared. Parents don't worry about that, even though in many ways vaccines are better because they give you tailored antibodies that are exactly your body's antibodies, but nobody wants to hear that explanation. So vaccines have gotten a bad rap, and some of it is actually worth having a bad rap. There have been mistakes over the years, and before, back even during polio virus time, they were pushing that very fast, and that was part of why the book is so good, is it talks about how Dorothy Horstman was one of the people that was like, wait, we have to make sure it's safe before we give it to all these children. And so I think there are reasons that people don't trust the medical field. So I think we need to first understand why people are afraid. We are starting a few studies right now and trying to understand what it is that makes people nervous about, and we have to collaborate with people who understand that better, psychology, social services, other things like that. And I think we also have to be more transparent. I was part of the CDC vaccine safety at the time, and I thought we were being transparent, but we also wanted to really make sure we understood something scientifically before we shared it with the public. And now looking back, I think that was sometimes a mistake, because we should have probably shared that process. It's a very difficult balance, I think, in in trying to analyze things scientifically, but also make sure you're being very transparent with the public. Yeah.
I have a question.
Yeah.
I don't know if you're aware of this or not, but in Marymount Square, there's a movie theater. And
Yes.
I belong to another group, it's a bunch of gentlemen farmers and gardeners and whatnot, and we have taken movies there and watched them. And I just wanted to give you that idea of, with polio and all of these other shots, to contact some of the local movie theaters all around Cincinnati. And I think you could talk them into doing it for free. And I really think that every movie theater, because if you do it in the morning, that's not their hot time.
Right,
They
right.
have to analyze what's good for them and what's good for you. But you could get a lot of free publicity and get it all over the greater Cincinnati and the northern Kentucky area just by contacting those theaters, I think.
You need to help tell people about vaccines.
I want them, that you just go to the theater and because you've got your material, outstanding.
Oh, you're
I
fine.
think it's outstanding, and I don't think most people don't take the time to do it. I'm the grandmother of a 3-year-old that I dearly love. She's going to be 4 in August.
Oh, that's
But
exciting.
you need to get the word out, and without spending money. You need to spend money on all your magnificent research. And I think that if you could make the local theaters a part of that, all they have to do is open your door.
Yeah.
That's it. And then you give them the video that they can show on the screen. You can fill all those movie theaters at whatever time is convenient for the movie theater.
That's a
And
great
you can give
idea.
them
Thank
very
you.
good publicity in the Enquirer and Cincinnati Magazine. So
We did just write a little piece in the Enquirer in the op-ed section, just not specifically about vaccines, more about pediatric health in general, because we are, we always try to advocate for the children. Oh, yes.
I've been to 93 countries, and I want to get to 100. And a lot of those countries are small, remote, backward countries.
Yes.
How do I know what's safe and what's not?
You mean if you live in one of those really rural communities?
I want to
Yeah.
visit. How do I know to check?
Where they have outbreaks and things like that. So there are very excellent resources. I actually answered a call this morning because there's a family traveling to Puerto Rico and they wanted to know, is there a measles outbreak going on in Puerto Rico right now? So the CDC's measles website is actually pretty up to date around the world, trying to keep track. The World Health Organization plus the CDC tries to keep track at any given moment if there are pockets of, you're right, there are rural areas that are difficult to reach, but the goal is that we at least have an idea of which cases and around the world where there are cases. But the easy solution to that, I think this is what we counsel this family, is, it's a super effective vaccine, the measles vaccine. If you're vaccinated, you really don't need to worry about it. It's a highly effective vaccine, and most of us, I know over the years, have gotten 2 doses. There's some age groups, as I'm sure you've seen in the news, that need a second booster dose, but for the most part, most of us are fully protected, which is great. Yes. Oh, sorry.
We're fortunate that there are one and done infectious disease vaccinations.
Yes.
Today.
Yeah.
But there seem to be things out there like the flu,
Yes.
COVID-19 that are recurrent for us. Are we going to just essentially have to do something about COVID-19 every year?
Yeah, that is an excellent question, and we spend a lot of hours and worries about that. I've spent a lot of my time investigating flu, and I swear that virus makes me insane. It just keeps changing on me, and COVID is doing the same. Yeah, they're viruses are very, very fascinating, and that is the main research at Cincinnati Children's. We are focused on viruses more than anything else, as evidenced by the polio virus and the rotavirus, and they are very sneaky, as you've seen with COVID. One of our big studies right now is to try to create a universal flu vaccine. That is sort of the holy grail of flu, is that you can get it somewhere where even if it changes, you will still be protected against it. So that is what we're working on. And actually the way we're studying that is by looking at moms and their babies to see that first exposure to either flu vaccine or flu virus, how your immune response forms then, so we can try to mimic it in a vaccine. So it's called the Imprint Study, and it is still, at this moment, funded by the NIH. We'll see how that goes, but at the second, we're still pressing forward. Yeah.
Hello. Thank you for this. This has been so interesting for me. One of my 4 brothers had polio, and my mother, I don't know why, chose not to give him the vaccine. So I watched him suffer throughout most of his life until he passed a few years ago in his 60s. And so one of my other brothers and his wife chose not to give to their 6 children any vaccines. So my question to you is, which I don't know if it's a silly one or not, but I'm going to ask, is as young adults now, for them, if it matters to them, is there anything they can do?
You mean
As far as the vaccination, is all those pediatric vaccinations that you have to be given at that time? And
so we do, the schedule is based on when you're most likely to get sick from that and you're most likely to be exposed. For example, the measles, you're more likely to get it around the preschool and school age point, which is why so it's both based on how the vaccine works and when you're most likely to get it. But it's still, we give catch-up vaccines all the time. You know, we will vaccinate you at any age. There are some things that are unlikely to be harmful to you when you're school age and some that are vice versa. But then a lot of them become high risk again when you're an older adult. So a lot of those you see that with flu and things. Like flu is really dangerous for little babies, and then it's dangerous again for older adults, and RSV. This is why the geriatrician in the house, we cover both ends of the spectrum. Yeah, we got the kids and we got the older adults. But yeah, a lot of the same things affect those. So I do encourage people, it's never too late to start if you change your mind. And that happens to us in the hospital when we see a family whose child comes in with meningitis and they realize, like, I really don't want this to happen to another kid. And we're like, we can help you out, no problem.
Without getting into our position individually on immigration, I know we have a lot of immigrant children, illegal and legal, out there. Is that skewing our numbers significantly? And obviously has to be.
It's interesting because at least for measles, it's less children from outside the country and more children who are in pockets of unvaccinated religious communities. So like our outbreak that we saw at Cincinnati Children's when I was a resident, it was a small pocket, a community that had chosen not to vaccinate, and then they took a mission trip to Romania and brought back measles with them, and then they infected many dozens of people in their community. And then they came to Children's, and thankfully we keep close track of who's been vaccinated, so we didn't spread any in the hospital. But yeah, that's what we've seen in Texas, and then our cases that we've had in Ohio. And that's actually a lot of the unvaccinated kids that I see are kids from some of our communities that the whole community isn't vaccinated. That was the same case in New York also. There's a county that's predominantly unvaccinated for religious reasons, and that's where polio popped up again, yeah. So that is part of the population that we've had really good conversations with, especially the ones close to us in Ohio, and not exactly Cincinnati, but a little north of Ohio. We've actually had one community member that they then decided to vaccinate the community after they had a case of, it was hid meningitis actually.
So my question is, how do you promote the administration of vaccines to the entire population when we currently have an individual Secretary of Health and Human Services who is at the best skeptical of vaccines?
Well, I promise not to get into that too much because it is, of course, the big elephant in the room. And many of you might know that the ACIP, the Advisory Committee for Immunization Practices, is meeting right now with most of my colleagues fired from it. So it's a tricky time, but I continue each day to focus on making vaccines safer, having conversations with the families on an individual basis, making sure that I talk to family members and friends about it if they want to talk about it, and just taking each day at a time and doing my best. And not giving up.
I'm currently reading Anthony Fauci's book, On Call. It's a fascinating read. He's the point doc dealing with AIDS.
Yeah.
And what I found very interesting is sort of going back to that element in the room, kind of getting funding for research. And in the book, it's very clear that when the funding is in place, advances can be made. So my question is, how concerned are you, how concerned are the Cincinnati Children's about the kinds of cuts that are being made, and how much might that set us back?
Yeah, I think the short answer is we are very concerned, and there are definitely a lot of people spending a lot of time talking about it. Dr. Fauci is one of my heroes. I got to meet him when I did my research in Honduras through the Fogarty Fellowship, which I was studying respiratory viruses, and so we had an orientation. Jane was 3 weeks old, 21 days old, and she came to Washington, D.C. and Bethesda also, we got to meet Dr. Fauci, and part of what he shared at that time, so this was back, she's 16, so 16 years ago, and so that was back when it was before COVID and before a lot, and his stories about HIV and how he was trying so hard to get the attention of the government and not forget all these patients was really very moving. So when he came a couple years ago to our infectious disease conference, and he was a surprise keynote speaker, he walked out and I burst into tears, because he worked so hard, and I do think it was a very hard road for him for many decades now. Like every administration, he has fought, because a lot of times, guess what doesn't make a lot of money for drug companies or the government? Funding HIV and TB research. Poor people have HIV and TB, and so it's a lot more lucrative for everyone involved to fund things that are not affecting poor people. And so, but I think hopefully you guys get a glimpse of, the world is a big place and we are all connected. And so if you forget some people, it's going to affect everybody else. It's not just, we have a lot of things in place. I'm thankful for Rotary International for stepping up to help with polio eradication. I know the Gates Foundation is not replacing some of the things that have been cut, but they are, in hyperdrive as well, trying to figure out to make sure we don't lose ground worldwide. So thank you guys for being a part of that too.
So as you know, Brian Bowling is coming up from the RA Convention, but the RA Convention is wrapping up. You might have heard that Rotary International is rededicating their funds for 3 more years of Rotary Impact. So that was voted on and approved. So the Gates Foundation, Rotary, and RA International working together to help in this great cause. And we are, in honor of your speech today, we're making a gift in your honor to end polio now, your dedication to all you do. We also remember today's speech and presentation, remember us. We're giving you a coin to remember today. The beautiful skyline with our Roman bridge is on one side of who will stay here later if she has any questions, but please honor her if she has to go back to work. So just be careful, and also let's thank her one more time for her great. Island room, and this is my last meeting with you, and I know Michael's stopping away. I know Lisa and Ed are going to do a phenomenal job for you. I'm senior here, I'll be past president starting July 1st, and I'm not going anywhere. We continue to grow this club and make this the best club in the world, and that's my goal. And let's continue on with Rotary. Thanks again. Thanks.
Yeah, for today. I do it about once. There's 4 guys. Good luck. Enjoy. I'm done.